Hi all, welcome to Physio Exam Buddy. This video is on the mismatched blood transfusion, one of the commonly asked short question in university exams. What is this mismatched blood transfusion? It is just the transfusion of the blood or its components that are immunologically incompatible with their recipient's blood group. And there are mainly two types of complications occurring due to mismatched blood transfusion. First one is that there occurs an acute or immediate intravascular hemolysis, followed by a delayed hemolysis or extravascular hemolysis. First, we will see the complications immediately occurring after a mismatched blood transfusion. It can be classified as acute or immediate intravascular hemolysis. Here, the reactions are very immediate and it is usually typically associated with APO incompatibility, which will result in complement activation as well as subsequent intravascular hemolysis, that is, lysis of the RBC within the blood vessels. And the main clinical features include fever, anxiety, chest or back pain, flushing of the skins because of vasodilatation, then dyspnea, tachycardia, as well as hypotension. And the main complications of this intravascular hemolysis is acute renal shutdown, then circulatory shock, and intravascular hemolysis. How acute renal shutdown occurs is it is mainly because of three reasons. First one is that there occurs an antigen antibody reaction which will release certain toxic substances from the hemolyzed cells, resulting in vasoconstriction in the renal blood vessels. Second one is circulatory shock. That is because of the loss of the circulating red cells as well as the release of these toxic substances. All these will cause a fall in BP, resulting in the circulatory shock. Along with it, the free hemoglobin, which is released as a result of intravascular hemolysis to the blood, becomes more than that it can bind with the haptoglobulin. Then the excess hemoglobin will leak through the glomerulocapillary membrane and there will be an increase in the hemoglobin level in the tubular fluid, resulting in the renal tubular blockade. So all these things, these three things, that is the renal vasoconstriction, circulatory shock and the renal tubular blockade together will result in acute renal shutdown and thereby the complications happening immediately after a mismatched blood transfusion due to intravascular hemolysis. Next is about the management of the immediate complications. First of all, you have to stop transfusion. Then immediate hydration will prevent the renal failure. Drugs like mannitol or furosemide can be given to maintain the urine output, and for treating hypotension as well as impaired renal perfusion, you can give vasoactive drugs like dopamine. If renal failure have already occurred, then supportive measures like fluid restriction, electrolyte balancing as well as dialysis can be considered. And if coagulopathy happens, then cryoprecipitate transfusion or fresh frozen plasma transfusion can be given. And in case of massive intravascular hemolytic transfusion reactions, exchange transfusions can also be considered. Followed by the acute or immediate intravascular hemolysis, the next complication is the delayed hemolysis in case of mismatched blood transfusion. And here the hemolysis is mainly extravascular, and this is milder when compared to that of the immediate reactions. That is, the transfused red cells are destroyed from 2 to 2 days after the initial mismatched transfusion, and this almost always represents a secondary reaction. That is, usually a primary antibody response is generally delayed in onset and slow to reach its peak. The main signs and symptoms you can get in case of delayed hemolysis is a falling hematocrit value, jaundice, fever, and a hemoglobinemia as well as hemoglobinuria. So that's about mismatched blood transfusion. Thank you.